for the United States Government Accountability Office in Washington, D.C. It's a pleasure to be here today to discuss GAO, the federal government's response to the pandemic, and GAO's audit findings. Next slide. So today I'm going to share some background on GAO and our work, and then discuss what has been a key focus for the agency and for the team that I lead for these past 2 years, the United States government's response to the COVID-19 pandemic. Next slide. Many of you may be aware that the International Organization of Supreme Audit Institutions, or INTOSI, operates as an umbrella organization for the external government audit community. GAO is a very active member in INTOSI, and we work with various auditing institutions across the world. Next slide. GAO is very unique and among the Supreme Audit institutions because we report to the legislative branch of our government, the United States Congress. Much of our audit work is started in response to either a request from a leader of a committee in the Congress, or it is mandated by law when legislation is passed. We are very fortunate that last year GAO celebrated its 100-year anniversary. Next slide. GAO's core values are accountability, integrity, and reliability, and all of our work is done in accordance with these core values. GAO staff are not political appointees. The head of our agency, the Comptroller General of the United States, is appointed to a 15-year term to his position, which shields it from political influence. We are often called the federal watchdog because we help Congress in their oversight of federal funds and departments in the federal government. GAO's authority is quite broad, and it allows us to investigate all issues where public funds are being used. The Budget and Accounting Act of 1921, which established GAO, also requires us to report on our findings and recommend ways to increase the economy and efficiency in government spending. Next slide. Approximately 3,000 staff work at GAO in our 15 mission teams. As of 2021, we had 3,200 full-time employees. 70% of the employees are located in the Washington, D.C. headquarters area, and another 30% in our 11 field offices that are spread throughout the United States. Our teams are filled with analysts, financial auditors, and other specialists like attorneys and statisticians who work on reports for the Congress. For example, the team I lead, the healthcare team, supports congressional oversight of federal healthcare programs, ensuring that they provide access to quality care, protect the public, and remain fiscally sustainable. The staff are highly educated, with about 70% of our analyst community holding a master's degree or higher. Now, 90% of our work consists of performance audits and policy analysis. The remaining 10% includes financial audits, forensic audits, and our own legal opinions. We use a variety of methodologies to accomplish our mission, but they include things like surveys, structured interviews, case studies, literature reviews, economic modeling, data matching, and file reviews. Next slide. Every fiscal year, we look back across all of our work at some key metrics to measure our contributions and value to the American taxpayer. Last year, in fiscal year 2021, we issued almost 600 audit reports across the federal government and had over 1,200 recommendations to improve the efficiency and economy of the federal enterprise. Over 75% of these recommendations are generally implemented within 4 years of us making them. And for each dollar that's invested in the GAO, the taxpayer sees $158 in return through the financial savings we've identified across the federal government. Next slide. Okay, now I'm going to cover the real-time auditing we've done during the pandemic to examine the federal government's response to the public health emergency. Next slide. For context, I wanted to share a little background on how the public health system works in the United States. It's a patchwork of different parts of our government. So the federal government, our state government, and then there are shared responsibilities between the two parties. In general, the public health authorities that we are working under rests with our states and not the federal government. States often will delegate some of those powers to their local authorities. So at the end of the day, our public health system in the US is very decentralized. States use their public health authority in a number of ways, such as enforcing safety and sanitary codes, licensing our healthcare workers and facilities, mandating reporting of certain diseases to authorities, and compelling isolation or quarantine in the case of a pandemic. While most authority rests within our states, the federal government nonetheless exerts a strong influence on public health practice through its ability to tax and spend and its responsibility for regulating interstate commerce. At the federal level, the Department of Health and Human Services, or HHS, plays a significant role in our public health care system, mainly by funding the public health activities of the states and by coordinating the federal response when a public health emergency like the COVID-19 pandemic happens. Some key HHS sub-agencies you may have heard of include the Center for Disease Control and Prevention, or the CDC, who combats emerging infectious diseases and public health preparedness. The Food and Drug Administration, or FDA, who is responsible for ensuring safety and effectiveness of drugs, vaccines, and therapeutics. And the National Institutes of Health, or NIH, who conducts and supports biomedical research, including medical countermeasures such as drugs and vaccines and tests that are there to detect, prevent, or treat illness. Next slide. The pandemic obviously has had a devastating impact across the world on both the economy and the health of our populations. In the US, we've already had over 1 million deaths and 85 million cases of COVID-19 so far. And we're obviously in a new wave. We're starting to see our increase in cases, as well as hospitalizations and deaths, which are both lagging indicators. We are still at a point where 82% of our population has received at least one vaccine dose, and only 67% of the population is fully vaccinated. In response to these devastating impacts, Congress passed 6 relief packages or pieces of legislation to deal with the pandemic. The total spending on this is $4.8 trillion, which is the largest amount of spending on federal relief efforts in the United States history. In healthcare, a number of pieces were done, including $178 billion for eligible providers to cover their healthcare related expenses or lost revenues attributable to COVID-19. $57 billion was allocated for procuring and distributing testing supplies and developing testing programs in the communities. $41 billion was allocated for vaccine development and procurement. $17 billion was allocated for development of therapeutics, and another almost $80 billion for increased healthcare utilization that was expected because of the pandemic. There were also funds for a variety of other programs that were aimed at stabilizing our economy and assisting individuals and businesses, such as lost wages, funeral expenses, education-related needs, money for small businesses, and direct payments to citizens. Next slide. Oops. Some non-funding related government responses that were related to public health include waivers that allowed for increased use of telehealth in response to the pandemic, requiring inspections of our nursing homes to focus on infection control, given how many nursing home residents faced COVID-19 outbreaks. And then multiple federal agencies provided personnel, built alternative care sites, and provided equipment to help surge the medical and public health capabilities. Next slide. During the pandemic, we have completed hundreds of reports and testified before the Congress on a wide array of government programs. We also provided monthly briefings to relevant congressional committees to keep them apprised of our progress. We were able to do this as an auditing institution because we had made previous investments in technology and had a longstanding experience with telework, so we were able to maintain our workforce. And we were able to leverage our previous experiences with past real-time auditing. We did reports during the global financial crisis in 2008, where we were able to report to Congress every 60 days about the progress of those funds going to the intended recipients. GAO will continue doing our work annually on the pandemic and the response through at least 2025. And next year we'll issue another report. So far we've issued 145 reports, including 10 comprehensive reports across the federal government. Next slide. In our reports, we've made over 250 recommendations, and these recommendations span the federal government. We currently have open recommendations related to COVID-19 targeted to nearly 20 federal departments or agencies. Agencies have fully or partially addressed 39% of the recommendations, fully addressing 22%, and partially addressing another 17%. Next slide. As an example of our work, I wanted to highlight some particular concerns we have had about the federal government's leadership and coordination of the public health response to the pandemic. GAO has long-standing concerns about the preparedness of our Department of Health and Human Services for public health emergencies and has raised issues prior to the pandemic about that readiness. In our work, we've identified 5 necessary principles for an effective federal response. Next slide. The unprecedented scale of the COVID-19 pandemic and the whole of government response required to address it highlight the critical importance of clearly defining roles and responsibilities for the wide range of departments across the federal government. We found some issues with supply chain responsibilities as well as with stakeholder engagement around a supply strategy. These stakeholders, which include the state and local governments as well as the private sector, have a shared role for providing supplies such as personal protective equipment, including N95 respirators, disposable gowns, and gloves during a pandemic. GAO also reported that communities of color have been disproportionately affected by the pandemic. And HHS developed the COVID-19 Response Health Equity Strategy with the goal to reduce health disparities by using data-driven approaches to attain the highest level of health possible for all individuals. When we looked at it, the strategy lacked important elements of an effective national strategy. But in response to our recommendations, HHS added key information to its plan, such as identifying what organizations it would work with to engage communities at higher risk of COVID-19. and to adopt better community mitigation strategies for these populations. So establishing roles and responsibilities and making them very clear is really important to make sure we know who is in charge and who needs to be involved in the response. Next slide. The second principle is very important: collecting and analyzing complete and consistent data. Since the beginning of the pandemic, GAO has identified concerns with federal COVID-19 data and underscored that in the midst of a national public health emergency, clear and consistent communication between the federal government and the public is critical, given that the federal government needs the public to participate in the response. So we found several areas where there were incomplete and inconsistent data during the response. At first, the data on spread of COVID-19 at the outset of the pandemic. The first test developed was faulty, which undermined the data collection on the spread of the virus during the early weeks of the pandemic. And we found that other countries were able to scale up their testing regimes faster. Throughout the pandemic, we reported on numerous ongoing data collection concerns, which have plagued our nation's ability to effectively, efficiently, and equitably respond, including the data on testing and case counts and hospital capacity. The data that HHS was collecting was incomplete and inconsistent, and some of this was due in part to how states are counting and reporting data. In addition, race and ethnicity data for COVID-19 cases for hospitalizations and deaths were also found to be incomplete and inaccurate or missing. We made some recommendations to improve the collection of those data, and the CDC worked with states to improve their quality of that data, and we've now seen improvement in that data reporting and collection. Lastly, data on nursing homes for cases and death. We found that reporting was optional prior to the pandemic, and so we wanted to see HHS make that reporting mandatory. Next slide. So our third principle is providing clear and consistent communication to all involved in the pandemic response. So we reported in our auditing on how at the state and local level, information was lacking on the federal government's plans for vaccine shipments, such as when they would arrive and how many doses, which made it very difficult for states and healthcare providers to plan their vaccine distribution. We also reported that there were inconsistent communications to healthcare providers on the recommended use of decontamination systems for masks and respirators, which led to confusion and hesitancy among healthcare workers in using this personal protective equipment. We also found that portions of CDC's guidance on reopening our schools were also inconsistent, and some federal guidance appeared misaligned with CDC's plans. In response, they did revise their guidance to be more clear and consistent. Next slide. The fourth principle is establishing accountability and transparency mechanisms. We reported that COVID-19 testing guidelines had changed several times over the course of the pandemic with little scientific rationale. Behind the changes were explained, which confused providers and public health stakeholder groups, and also put the government at risk of eroding public trust. We also reported that the federal agency in charge of our strategic national stockpile, which contains all of the measures to counteract a pandemic and a public health emergency, did not have policies and procedures in place to ensure that the money being spent on these supplies was actually being spent properly. So it couldn't ensure that the supplies received by state and local governments were accounted for completely, which creates a risk of improper payments for incorrect supplies or quantities, or for unintended supplies being delivered to the wrong recipients. We also found that HHS did not publicly report data showing vaccination rates specifically for nursing homes, and did not collect or report vaccination data for nursing homes. So we recommended that they collect and make these data public, which they started to do, and started posting it on their public website. Next slide. Principle number 5 is understanding key partners' capabilities and limitations. We also identified during our audit work that the federal agency in charge of responding to public health emergencies did not fully understand the capabilities and limitations of their key federal partners. And we have identified concerns with the same agency's capabilities to fully execute their preparedness and response activities, especially as they have increased during the pandemic to include a number of things that help with the public health emergency. Next slide. Other GAO work in the healthcare team has reviewed the flexibilities that medical providers participating in federal healthcare programs can adopt during the pandemic. These included waivers from the federal government that allowed hospitals to expand their capacity, allowed healthcare workers to eliminate certain requirements for licensure, and allowing for more telehealth in all federally run health programs. Mostly these program flexibilities benefited patients and clinicians, but we did find that there may be some increased risks to the programs, such as risks to patient health and safety, or to incidents of increased fraud, waste, and abuse. Next slide. So GAO continues to provide oversight across the whole of government, and we work with our accountability community partners to identify important trends and coordinate our efforts. In many ways, the pandemic has exposed and exacerbated some very long-standing issues within our public health system and our public health delivery. And there's a keen interest from Congress and others to address these issues beyond the pandemic. We hope our work will be there to help assist them in making decisions about what is the next steps and how to be prepared for the next pandemic. We'll continue our oversight efforts on behalf of the Congress and the American people. We currently have more than 70 ongoing audits, and will continue to track the historic levels of federal spending and resources through 2025, as I noted. This concludes my presentation. I want to thank you for your attention, and I'm happy to answer questions.
Muchas gracias por tu brillante participación, Jessica. Vamos a pasar a la etapa de preguntas. Y bueno, quisiera primero plantearte lo siguiente. Evidentemente que el sector salud ya de suyo es una rama que es muy difícil de auditar, entre otras cosas porque los médicos, más allá del ejercicio de los recursos o del cumplimiento de las políticas administrativas para la asignación de los recursos, siempre ponen por delante la integridad y la salud de las personas. Tan es así que en algunas ocasiones comentan, no hay dinero, entonces tú vas a ser el responsable de que se muera un paciente. Sin pandemia ya es complicado. En medio de la pandemia, donde había que atender los efectos mortales de la COVID-19, ¿cuál fue el reto más importante de tu dirección para la obtención y análisis de información en medio de la pandemia con personal dedicado a la atención médica y no necesariamente a la gestión de los recursos.
Okay, thank you for that question. So the question was, what are some of the challenges given the complexity of the healthcare system and the need to treat patients first and foremost during this pandemic? So what challenges did we face in gathering data and doing our analysis? So the biggest challenge that GAO faced in doing our work was that we were dealing with the department, HHS, trying to respond to the pandemic at the federal level and work with their partners at state and local governments, and responding to our requests for information, for documentation, for data, trying to talk to the individuals that were responsible for implementing the policies and programs that were intended to respond to the pandemic, made it very difficult. We also tried to talk to hospital facilities, for example, to ask them what kind of shortages they were facing, what kind of challenges they were facing. And again, they were faced with trying to treat patients while at the same time trying to respond to our requests for information. So what we did to address some of these challenges was try to coordinate with our audit partners across the federal enterprise. So our inspector generals, which is another part of the US's sort of audit community. So we would ask, questions and for information in a consolidated fashion so that everybody would get all of the information, but we wouldn't be going back to the same people more than once. We also tried to do some preliminary work to reach out to some of the healthcare providers to see if they would have time to speak with us and share information. We tried to coordinate as best we could with their schedules and plans. So the biggest challenges were trying to audit healthcare during the pandemic while all of the healthcare system was trying to respond to the pandemic, to the patients. We used whatever tools we could in terms of setting up interviews and consolidating our work with other partners to try to get responses and get information.
Muchas gracias. Ahora, en un país con 330 millones de habitantes, en donde justo tener los medicamentos y una estrategia de inmunización lo más pronto posible, entre sus hallazgos se cuentan precios elevados, es decir, sobrevaloración de los precios en los medicamentos, en las vacunas, en general en material de curación, desvíos de recursos o mala orientación de los mismos, es decir, que no se apliquen para los fines que fueron establecidos.
So thank you. The question I think was, given how large our population is and how much medicine and vaccines and therapeutics were needed, did we find in our work whether or not there were elevated prices for drugs and vaccines and other materials and resources being used to respond to the pandemic? So far in our findings, thank you. We, prior to the pandemic, the United States has had an issue with drug prices being higher than other countries. In part, our economy allows for the free market to take place and for drug companies to charge what the market will bear in charging us for drugs. So there are limitations on what the government might pay, but the rest of the healthcare system pays whatever is whatever the company decides to charge. With the vaccines, because the federal government purchased almost all of the vaccine for distribution to our population, they negotiate a price for the Pfizer vaccine and as well as the Moderna vaccine. So those are the two vaccines they purchased the most quantity of. Some of those prices were very similar to prices paid in Europe, and some of those prices were higher than the prices paid in Europe. We plan to do some future work looking at this. We have not sort of fully assessed whether or not these prices were properly negotiated, in large part because the intent of the government at this point was to get the vaccine distributed to as many people as possible. And so we do have some planned work to look at the prices that were charged and how that was negotiated.
Gracias. Mencionaste, Jessica, que la GAO no es política, es un ente técnico. Sin embargo, en medio de la pandemia se cuestionó en aquel entonces al presidente Trump el manejo de la misma. ¿Cómo resiste la GAO los embates de la política que afectan a un presidente y que eventualmente puede ser utilizada como un arma política?
Okay. So I think the question was, I had mentioned that GAO is not a political entity, but during the pandemic, the former president was accused of interference during the pandemic, and how do we deal with that? So we have ongoing work currently looking at how the agencies in the federal government are putting policies in place and whether or not they follow the policies during both the previous administration, so the Trump administration, as well as the current administration, the Biden administration. So are they following their scientific integrity policies? And are they doing things to prevent political interference with the science and other aspects of the response? So that work is still ongoing. We're looking at it right now. We did issue a report on the scientific integrity policy aspect, so looking at the policies themselves and whether or not the staff are fully trained. And we think that there needs to be some more training and clear expectation setting around these policies with agency staff. But the political interference piece of the work, we have ongoing work that we expect to issue sometime early next year in 2023.
Muchísimas gracias. Del público, en los análisis que llevó a cabo la GAO de una cantidad muy grande de datos, como lo mencionaste, ¿pudieron identificar el impacto que la COVID-19 va a dejar hacia futuro en la esperanza de vida de la población, evidentemente?
No. So the question was, have we been able to identify the COVID-19 impact on life expectancy so far? GAO has not done work on that yet. And in fact, we probably would rely on CDC to report the statistics on that issue of how it's impacted life expectancy. We have reported on the fact that COVID-19 has led to hundreds of thousands of excess deaths, so more deaths than we would expect during the pandemic, and we can look at previous trends, and those data are not affected by problems with reporting. They tend to show that we've had, way more excess death than we would have expected during the pandemic. That's attributable to the pandemic, but we have not studied life expectancy.
Gracias. ¿Detectaron actos de corrupción y en su caso, cuál es el tratamiento que da la GAO?
So we in the healthcare team did not identify corruption in the work that we're doing. However, our team that looks at forensic auditing and investigative services has identified a number of fraud-related cases across the federal government in all the areas where money was provided. So they found fraud cases with healthcare providers. They found fraud cases with various businesses that got loans from the federal government, various people getting direct payments that shouldn't have gotten direct payments from the federal government. They found fraud in the funeral assistance program. So we definitely found fraud and abuse in a number of different programs. My team is not responsible for weeding out the fraud and abuse. We have a separate team at GAO that does that work, but they found a number of different cases of fraud.
Interesante. Ahora, ¿qué pasa o cuáles son los siguientes pasos por parte de las instituciones que reciben las 294 recomendaciones de la GAO, de tu departamento en particular?
Right, so we are, every quarter, we're updating the recommendations that we make. So we are talking to the agencies on a quarterly basis to find out what they've done to respond to our recommendations. We're evaluating the information they provide to us, and then closing the recommendations or keeping them open. And we're regularly reporting to Congress the status of those open recommendations. Even beyond the pandemic, every federal agency must share with Congress as part of their budget request how they've addressed or not addressed GAO's recommendations. So we're in the process right now of the budget being formulated in the United States for the next fiscal year. And so every agency had to share with Congress what they had done or what they hadn't done to respond. So there's various sort of levers that we use to pressure them to respond to those recommendations. And as I said, generally speaking, a lot of them, about 75%, will get implemented within about 4 years. So we're hoping we have a similar result for these recommendations. But we continue to add to those recommendations as well as we're continuing to do work looking at the response. But I think that answers the question.
Gracias.
Thank you.
Sí, muy importante. Ahora, Jessica Farb, como responsable y líder de la fiscalización de de los recursos aplicados en medio de la pandemia, ¿cuál consideras que fue el mayor aprendizaje para tu oficina?
I think that the biggest lesson learned for the federal government is that we're not prepared for the next pandemic, which is, you know, given what's occurred with this pandemic, it's not a good thing. So hopefully, as I said, there's a lot of interest from policymakers in trying to address some of these problems we've seen in our public health system. There hasn't been enough funding provided. There hasn't been a nationwide surveillance capability built. There hasn't been enough investment in vaccines and therapeutics to make sure our strategic national stockpile has what it needs. And there hasn't been a good coordinated effort to make sure that the supply chain for healthcare supplies is resilient and ready to go should there be another pandemic, which there will be another pandemic. I hope it's not in our lifetimes, and I hope if there is something, it doesn't look like COVID-19.
Sin duda. Y ya para cerrar, una pregunta del público también. En uno de los principios mencionaste la transparencia como un elemento importante. En México, el gobierno mexicano en algún momento intentó poner un velo, es decir, generar una suerte de clasificación o reserva como información confidencial a los recursos destinados para la pandemia. ¿Sucedió algo similar en Estados Unidos? ¿Algún gobierno estatal o el mismo gobierno federal puso un velo o trató de clasificar como confidencial la gestión de los recursos para la pandemia?
No, I don't think the resources for the I'm sorry, I forgot to repeat the question. The question was, have the resources, has the federal or state or local government tried to hide the resources or their expenditure of the resources during the pandemic from the public? No, I think the issue for transparency for us, most agencies and government entities are responsible for reporting Their spending of federal funds to the Treasury Department, and the Treasury is supposed to make sure that data are accurate and people can find out what's been spent on what. So we don't have a problem with transparency of reporting funds and resources. Our transparency problem has to do with the government sharing kind of the decision-making process and making sure they're very clear about, you know, what are the issues, what are the problems that we're facing. They haven't done a great job sharing information about their plans in advance so that the state and local entities know what to expect and when they're going to need to act and what they need to plan for. So that's where the transparency has broken down in our system. The funding itself, we could always use better, more timely data, more accurate and complete, especially when we're trying to do real-time auditing. But we are able to get data that is required to be reported to the Department of Treasury so that anybody can track how funds are being spent across the government.
Muchas gracias. Pues hemos concluido este ejercicio de preguntas y respuestas. Le agradezco mucho al maestro Arce por la confianza, a Carlos Miguel también por haber hecho posible este evento, dado que él coordinó los trabajos, a la maestra Betty de mi parte el agradecimiento y un reconocimiento especial a nuestra intérprete Ana Bautista, que ha sido sin duda muy puntual en su trabajo. De mi parte me despido, muchísimas gracias y cedo el micrófono a la maestra Beatriz Pérez.
Muchas gracias al maestro Alfredo Cristalinas Kaolitz, que es vicepresidente de Comunicación y Difusión de la AMDAD, al maestro Enrique Arce Bravo, que es el presidente de nuestra academia, y por supuesto a la maestra Jessica Farb por compartir sus conocimientos y experiencia con nosotros en esta conferencia magistral, experiencias de la GAO en auditorías a la respuesta a la pandemia del COVID-19. Agradecemos también el favor de su atención y su asistencia a todos los participantes. Nos despedimos deseándoles una excelente tarde y hasta la próxima.
Thank you all. Thank you. Thank you.
Muchísimas gracias.
Gracias.
Thank you. Anna, thank you.